Jesse Dan John, welcome. CEO East View Variety Shop. Wow, you're welcome. Angelica, you're welcome. You're welcome. We'll start in a few minutes' time. You're welcome. East View, you are most welcome. All right. Good evening, all. You're welcome to the online tutorials with From Eternity the Schoolboy. Today, we'll take a look at actions and uses of medicines. Action and uses of medicines. The course code is AUM 321. We are still discussing the topic, cardiovascular system drugs. Yesterday we stopped at diuretics. Yesterday we stopped at diuretics and we discussed the 4 major categories. We listed and discussed them. So today, remember, we are treating cardiovascular system diseases, treatment of diseases. So we are now going to the pharmacological treatment of cardiovascular system diseases. So we discussed congestive heart failure and hypertension. Most of the drugs we are calling now, they have sheer indication for both congestive heart failure and hypertension. Excuse me. Okay, so let's continue. All right, so today we go over to another class of drugs for the pharmacological treatment of and management of cardiovascular diseases. We look at the vasodilators. From the name vaso, vessels, blood vessels, dilators. They help to do what? Dilate the blood vessels for easy flow of what? Blood. So as to reduce the pressure of the blood, the force with which the blood hits the walls of the vessel, which increases the blood pressure. So this tends to do what? Expand, let me borrow the word expand the blood vessel so that they will not be narrow, so that the blood can flow without increasing what? Pressure. So that's what this class of drugs do, vasodilators. Okay, so basically, vasodilators, they dilate the blood vessels. They dilate the blood vessels. So by dilating the blood vessels, they allow more blood to leave the heart. That is for those that work more in the heart. Anyway, generally, because those that act peripherally, as the blood vessels, peripheral blood vessels, as they are dilated, so the blood from the heart can easily do what? Come out. Because remember that any block in the movement of the blood, be it peripherally, will still bounce back to the heart. So with this now, once the blood vessels they has been expanded, or you find out that the blood will flow smoothly without what? Without constriction, without what? Blockade, and which normally leads to what? Increase in what? Blood pressure. Okay. So now they also prevent, of course, if they allow blood to leave the heart, they will prevent what? Congestion. So they prevent congestion. And ultimately, they will increase what? Cardiac output. Ultimately, they increase what? Cardiac output. They increase cardiac output because the blood accumulated, a fluid accumulated, will now come out from the, will now be pumped out from the heart. Okay. Now they act both on the what? Both on the arteries and the veins, but their action on arteries are stronger than their actions on what? On veins. Okay. Specifically, they relax and dilate the arterioles. They relax and dilate the what? Arterioles. So if they relax and dilate the arterioles, what are the implications? The implication is that blood can easily do what? Flow from the what? Right ventricle to the what? Lungs easily. The same way blood can also be pumped smoothly from the aorta down to the what? Other parts of what? The body. Now, of course, all these things that I've been explaining gears towards what? Lowering the what? The blood pressure. All these things I've been talking about gears towards lowering the what? Blood pressure. At the end, blood pressure will be what? Lowered. So they lower the what? Blood pressure. Now, by lowering the blood pressure, they've also decreased the what? The workload of the heart. So the heart doesn't need to really pump hard, do much work. At ease, with smooth contraction, smooth pumping of the blood, contraction, beats, the heart can do its work without having to fight against what? Workload. So in so doing now, of course, if the heart doesn't need to work too hard to pump out blood, there will be what? Decrease in what? Oxygen what? Consumption. Decrease in what? Oxygen what? Consumption. Okay. They can also be used to treat congestive what? Heart failure by what I explained, by decongesting the heart and making blood to be able to flow. You don't to be told that these drugs can also do what? Used to treat what? Congestive heart failure. They can be used to treat congestive heart failure when used alone or in combination with cardiac glycosides, even with what? Diuretics. So if you can combine them with cardiac glycoside and diuretics to treat what? Congestive heart failure. They can also be used alone to treat what? Congestive heart failure. Okay, specific example I want to mention is what? Nitroglycerin. This nitroglycerin relaxes the what? Smooth muscles. By relaxing the smooth muscles, it causes what? Venous dilation. And by dilating the veins, it also do what? Decrease the what? The workload. I think I've mentioned this before. Workload of what? The hearts. It also dilates the arteries that enters the what? The hearts. Does artery enter the heart? Is it the artery? Yes. Coronary artery also supplies the what? The heart. Okay, let's go. So when this happens, coronary artery supplies the heart. So arteries enter the heart too, because the heart that is pumping this blood needs to also be supplied with what? Nutrients too. Be supplied with what? Oxygen. So the heart itself needs artery. That's the coronary what? Artery. So it dilates the coronary artery. So what is the implication? It improves what? Cardiac oxygen what? Supply. Yes. So angina pectoris will not be an issue, all things being equal. Okay, now, these vasodilators, we have the one that we call peripheral vasodilators, and what? Coronary vasodilators. Peripheral means that they act in the blood vessel apart from the one in the heart, outside the heart. Coronary in the heart. Okay. So let's talk about the peripheral vasodilators. These ones, they act directly on where? On the blood vessels in the arms and legs. They are used to treat moderate to severe hypertension. Peripheral vasodilators. They act where? Blood vessels in the arms and the legs. They are of importance, of great importance in the treatment of what? Moderate to severe hypertension. Now, they can be used in combination with diuretics and or other antihypertensives. So they can be used in combination with diuretics. So you can see peripheral vasodilators combining with what? Used in combination with what? Diuretics, or even with any other what? Antihypertensive. Examples of peripheral vasodilators are: one, we have hydralazine. Hydralazine is a typical example. Hydralazine. We also have isosuprene. We also have HCl. We also have minoxidil and papaverine hydrochloride. We have hydralazine, isoxsuprene hydrochloride. We have minoxidil, and we have papaverine hydrochloride. So these are some of the examples of peripheral vasodilators. So let's look at these ones are in core. Now let's look at their what? The dosage form. Yeah, the dosage form, the strength, then the dose, the average adult dose. So for hydralazine, of course, the most popular brand name for hydralazine is what? Apresolene. For hydralazine, we have what? Apresolene. Okay. Okay. So it comes as tablet. It also comes as injection. So you have maybe if you powder for, I think the one I've seen here is powder for injection. Now we have for tablet, we have 10 milligram, 25 milligram, 50 milligram, and 100 milligram water tablet. It can come in any of these strengths. 10 milligram, 25 milligram, 50 milligram, and 100 milligram. And it is used orally 4 times a day. QID, 10 to 50 milligram QID. Okay. Then as injection, we have a 20 milligram per ml injection. And can be used IV, can be used unnecessary 20 to 40 milligram. IV and necessary 20 milligram. Okay, let's look at isoxsuprene hydrochloride. Here we have it as 10 milligram, 20 milligram tablets. Can be used 3 times a day to 4 times a day to 20 milligram. We also look at minoxidil. This minoxidil comes as tablets 2.5 grams. It can be used undivided, it can be used divided, but basically it is used as 10 milligram to 40 milligram per day. 10 milligram to 40 per day. It can be divided. Then papaverine hydrochloride. Papaverine hydrochloride comes as time release capsule. TR, time release capsule, 150 milligram. Time release capsule. and is used every 12 hours. 150 milligrams every 12 hours. 150 milligrams every 12 hours. Okay, that's the much you can take on peripheral. You can go deep into the that with. I'm just in the scope of the course treating. Right. Let's look at the coronary vasodilators. These coronary vasodilators, what do they? They promote immediate dilation of what? Promote dilation of what? Coronary what? Vessels. Immediate dilation of coronary vessels. Go to 911. You're welcome. Like in 5, call me Kuti 20. You're welcome. Please like this live, share with your friends, invite them to come. We are live now. Invite them to come. Please, for the full lectures, go to our YouTube channel. Our YouTube channel name is From Eternity, the Schoolboy. I'll write it on the board now. Go and subscribe. Subscribing is just click on the button, on the description button, subscribe. Button is red in color, and by the side you see a button that looks like bell. Click on it so that after the recorded live, so it's the live lecture, or if there you are live lecture there, just go to the square like button. You go to the, you create the playlist of courses like this. Now 3, 2, 1 in 3 is under pharmacology. Click on pharmacology. You see all the lectures we run under pharmacology. All right, so you're welcome once again. Let's just say that vasodilators, they promote what? Immediate dilation of the coronary. You know that coronary artery supply the heart, the margin. So this dilation allows to get to the self, not the one that is passing and go along supply the heart itself, because the heart nutrient and oxygen. Radium is actively a lot of mitochondria actively contracting, pumping, a lot of electrical impulses going on there. So you need what? Energy. Without oxygen, there will be a problem. So that's why oxygen supply to the heart itself is very, very important. Okay, so they are treat what? Acute angina pectoris. Of course, if oxygen is not properly supplied to these heart muscles, there will be a problem. That's what leads to the pain, apart from ulcer and other issues. Angina is a leading cause of the pain on the chest. So it's called acute angina. It can start with as acute angina. So this can be used to treat acute angina pectoris. Angina pectoris. Angina pectoris. Okay. Can also do chronic angina. It also used to manage chronic angina. Examples: coronary vasodilators that through glycerate, nitrate, isosonitrate, even our blocker also, and even our effect too. Also, you know calcium in contraction. So if calcium channel is blocked, that because of calcium, then know what? So calcium channel block are also indicated, are also coronary water constricted. Sorry, why do I always mention constrictors? Vasodilators. All right, so now let's look at examples. Some of the examples of coronary vasodilators. Here we have isoside nitrate. Isoside dinitrate comes as tablet. It can also come as sustained release tablets. We have a tablet, normal tablet. It comes as what, 5 milligram. You see it as 10 milligram, 20 milligram, 40 milligram tablets. 10 milligram, 5 milligram, 10 milligram, 20 milligram, and 40 milligram tablets. In such case, orally every 6 hours, 10 to 40 milligram. Every 6 hours, 10 to 40 milligram. It also come as chewable tablet and SL. We have it as 2.5 milligram. We also have it as 5 milligram and 10 milligram. Okay, so for chewable SL, we have 2.5 milligram to 5 milligram. 2.5 to 5 milligram. And you chew it until what? Up to 5, depending, until you start feeling the relief. So this is, remember, this can be used in treatment of what? Acute angina. Chronic one. Management of chronic angina. Okay, let's look at isosobide mononitrate. Isosobide mononitrate. Isosobide. Dinitrate. Isosobide. I hope I got the spelling. Mononitrate. Isosobide mononitrate. She's not clear. Let me write this well. Isosobide. This one is isosobide dinitrate. Isosobide. So isosobide mononitrate, you also have it as what? 10 milligram, 20 milligram, and 30 milligram what? Tablets. Sorry, 10 and 20 milligram normal tablets. In normal tablets, you use 20 milligram twice daily, but give 7 hours space. 20 milligram twice daily, give 7 hours gap. For normal tablet of 10 milligram, 20 milligram, but for extended release tablets that comes at 30 milligram, 60 milligram, 80 milligram. In this case, 30 to 120 milligram is used orally daily for ER, extended release tablet. Daily is 30 to 120 milligram daily. But for normal tablet, we have your what? To once daily, even 7 hours interval. But now the lot is glycerin, nitroglycerin, out beta blockers, because we still talk about them in other sites. So that want beta blockers and calcium channel blockers. Now separate. Now look at nitroglycerin. So nitroglycerin can come tablet, normal tablet. It can also come as sustained release capsules, ointment, come as trans 0.6 tablets, and SL anyway, but not take more than You should take more than 3 tablets in one tablet SL. One tablet 5, but you should not take more than 3 in 50. So for SR capsule sustain release, SR capsules, we have 2.5 milligram, 6.5 milligram, and 9 milligram. So 2.5 milligram 4 times daily, up to 6 milligram. So from 2.5 milligram to up to what? 6 milligram 4 times daily. But it's always good to give. You have to 20 milligram, you go and start with 20 milligram. Give the smallest effective. If 2.5 milligram very effective, focus on that 2 milligram. So don't just say because we have 2.5 milligram to 6 milligram, you go and start from the larger dose. Try to start from those. So far it is effective, you can stop there. To gain increasing the dose, because the more you increase the dose of anything, the more you are increasing the side effect of that drug. So if it's a small dose can give you what you are looking for, give the small dose and achieve the dose. Don't start giving larger dose. Let me explain. If 2 milligram give the same effect, therapeutic effect as 10 milligram of a drug, and you know that if you increase dose of a drug, you are increasing the size of the drug. But 2 milligram can give you the same effect with 10 milligram. Why give 10 milligram? Give 2 milligram. That's what this statement is trying to explain. Okay, now let's look at the topical ointment. The topical ointment is 2%. That's we have 2 gram of what? 2 grams 2 gram of electrolyte in every what? 100 ointment. That's mean of 2% ointment. Okay, so we have 1 to 2 inches to be given every hour. You can give up to 4 to 5 inches every 4 hours. It's okay. Then for transdermal patches, we have transdermal patches. We have the one of 0.2 milligram per hour. We have the one of 0.4 per hour. Then we have the one of 0.6 milligram per hour. These are the different patches. Strength of the patches, you have nitroglycerin. You can have. So give the normal dose is 2 to 0.8 0.2 to 0.8 milligram hour. So these some of these coronary vasodilators we can take for now. Remember I said that beta blockers and channel blockers will not be here now. So these all will take so that let's find out more on this group of words. This group we want to go are the angiotensin converting enzyme inhibitors. Angiotensin converting enzyme inhibitors. Angiotensin converting enzyme inhibitors. Angiotensin converting enzyme inhibitors. Christopher, you are welcome. You're just joining now. Okay? Okay. So let's look at angiotensin converting enzyme inhibitors. ACEIs. ACEIs. Angiotensin converting enzyme inhibitors. For us to understand this group of antihypertensive and congestive heart failure drugs, we need to understand a system in the body we call RAS. To understand a system in the body we call what? RAS. RAS. If you don't understand RAS, you won't be able to understand this ACEIs. RAS means renin angiotensin aldosterone system. Renin, angiotensin aldosterone. Okay, before we do that, let me break down of what these ACIs are. Okay, in fact, ACIs are promising to be one of the best treatments for CHF. Now, in fact, they are promising to be drug of choice for what? CHF. Now, yes, what that's so. But this one are promising to be very, very, very what? Effective in managing the treatment of what? Congestive failure. Even though they are antihypertensive, they have promised to be what? Very good at treatment of what? Congestive heart failure. So they lower the blood pressure. When we go into RAS, you understand how they lower the blood pressure. They lower the blood pressure and they also shrink enlarged hearts. They also shrink enlarged hearts. Ultimately, they increase vital signs. They increase vital signs. So they act on the RAS of the kidney. On RAS of the kidney. Remember what I said? RAS is what? Renin, angiotensin aldosterone system. So let's talk about RAS before we now talk about the effect. Okay. Okay, it has not. Okay, so now kidney renin. What does this renin do? I'm discussing this at this level. I'm not going molecular what happens at the moment. I don't want to go deeper than this scope can carry. The scope, the conlin. At the molecular level, start talking about which peptide. No, I just want to go and hit the main point. Now, kidney renin produced in the kidney to angiotensin 1. So this angiotensin 1 affects the blood pressure. But what happens is that this angiotensin 1 is converted to angiotensin 2 by the action of angiotensin converting enzyme. Angiotensin converting enzyme converts angiotensin 1 to angiotensin 2. Now, angiotensin 2, what does it do? Angiotensin 2 on its own is a natural vasoconstrictor. It causes vasoconstriction. It constricts the blood vessels. And when this happens, you know the implication. There will be what? There will be what? Increase in blood pressure on its own. But it doesn't stop there. It also stimulates the secretion of what? Aldosterone. Angiotensin 2 also stimulates the secretion of what? Aldosterone. Now, the aldosterone produced causes reabsorption of what? Reabsorption of what? Let me just go straight. It causes what? Salt. Remember, this thing will do what? Increase in the what? The blood pressure. So this RAS on its own, taking angiotensin directly in vasoconstriction and passing through aldosterone and end up increasing the retaining salt and water, of course, that will increase in what? Blood pressure. So A will be increasing blood pressure at the end. At that level of angiotensin 2 or aldosterone. So this whole can increase in what? Blood pressure. Now, this is where these inhibitors now come in. Angiotensin converting inhibitors. What do they do? So this angiotensin they do. So this angiotensin 2. So no matter the amount of angiotensin 1 produced by the action of renin by converting angiotensinogen to angiotensin 1, once if the angiotensin 1 is not converted to angiotensin 2, there will be no angiotensin 2 to bind in angiotensin 1 receptor that will cause what? Lead to vasoconstriction. So there will be no angiotensin 2 to bind to the receptor. So what that prevention of converting angiotensin 1 to angiotensin 2 is the point of action of these ACIs, angiotensin converting enzyme inhibitors. They prevent conversion of angiotensin. Remember that angiotensin 1 has no effect on the blood pressure, but they prevent conversion of angiotensin 1 to what? Angiotensin 2. So that this level, probably not to go deep and cause covers who is this and tell you between the angiotensinogen and what the conversion and at the secretion of. So this is exactly basically what happens. And so once they prevent conversion of angiotensin, so what are the side effects? Angiotensin converting, the general effect of them are dizziness, deadness. The popular fact that is when once you mention the first side effect, dry cough is what just dry cough from ACIs to was that this makes the patient on a dry cough makes the patient uncomfortable. Some examples of this we have the one that is common here, benzapril, we have enalapril, we have enalapril, plus hydrochlorothiazide. I'm looking at channel plus plus veramine. These are all the same converting enzyme. What is this group? They normally end with suffix. They normally end with prayer. Prayer, as you can see. Let's see. No prayer and now prayer. Prayer. See prayer. One thing you can identify this. I think please be careful. You know, video. So you confuse. You may see one name that do not taste. You say because I say prayer, I'm going to take it. You first know the drug first. I just want you to know the normal end with prayer. The normal end with suffix prayer. Okay. Please, if you have any question, please feel free to drop your question. Please share Verse 25, you're welcome. You're welcome. Complete TV, you're welcome. Rashid, you're welcome. Please like, share this live stream. Invite others to join. Invite others to join. Lectures, for the full lectures, go to our YouTube channel. The YouTube channel is on the board for maternity discussion. So you can access to our full live recordings. Okay, let's just list the strength of this for group of. Okay, now, so let's look at prayer. I was saying benazepam. Benazepam. So this benazepam is in tablet dosage from tablet 5 milligram, 20 gram, 4 gram tablets, 5 milligram, 10 milligram, 20 milligram, 4 milligram dosage. You have 40 milligram to be divided into 2 doses. 10 milligram in 2 short milligram per day. Then we have the combination. These plus channel blocker amyloid. You can choose those combination where amlodipine is benazepam is 10 milligram, amlodipine is 2.5 milligram. We also have the one where benazepam is 10 milligram, amlodipine is 5 milligram. We also have the one where benazepam is 20 milligram, amlodipine is 5 milligram. Also the one with benazepam 20 milligram and amlodipine 10 milligram. But generally, for the dosage, the dose you do not exceed 80 milligram benazepam and 20 milligram amlodipine So now the next one is captopril. So captopril, we have it as 12.5 milligram. We also have it as 25 milligram. We also have it as 50 milligram and 100 milligram tablets. So you should be taking twice a day or 3 times a day, 25 to 150 milligram. Twice a day or 3 times a day, but you should not exceed 450 milligram per day. The maximum daily dose is 450 milligram per day. Okay, we also have just a combination of captopril and the hydrochlorothiazide. So we have the following combination, fixed dose combination, FDC. We have the one that contains captopril in 1 tablet, captopril 50 milligram and hydrochlorothiazide 25 milligram. We have captopril 50 milligram and hydrochlorothiazide 15 milligram. We have captopril 20 milligram, hydrochlorothiazide 25 milligram. We can also have captopril 25 milligram and hydrochlorothiazide 15 milligram. In this case now, in what we are taking, you should not exceed in a day 150 milligram captopril and 50 milligram hydrochlorothiazide. Then we have enalapril. Enalapril is common in Nigeria market. Enalapril have one of 2.5 milligram. We have 5 milligram. We have 10 milligram. We have 20 milligram tablets. Please, at this juncture, I will encourage you. If you watch, I focus mainly on the generic name. I just mention brand name once in a while. Please, for the brand name of these drugs in Nigerian market, I will advise you go for MDEX. Go for MDEX. This one is 31st edition, 2022 to 2023 edition. There is 2023 to 24 edition available now. Go for MDEX. This is number 1 drug information. Number 1 drug information for Nigerian brands. So most of these things I'm calling here, if you open MDEX, you see the brand name available in the Nigerian market. Please go for MDEX. All right, so as you study these things, these generics, try to look up the brands in the Nigerian market. Go for MDEX. Okay. All right, let's continue. So you have enalapril. Okay, I've talked about enalapril. I said that you can have it as what? 2.5 milligram tablets, 5 milligram, 10 milligram, and 20 milligram tablets. You can use it 10 to 40 milligram daily, or you cannot be doses. And we also generation of enalapril diltiazem. Here now we have another diltiazem as 180 milligram. No matter whatever you are taking, you should not exceed in a day 40 milligram enalapril and 300 milligram diltiazem in a day. Then we also have an enalapril combined with the pain. Felodipine, we have, in that case, enalapril 5 milligram. We have a fixed dose in one tablet of enalapril 5 milligram and felodipine 2.5 milligram. You can also have enalapril 5 milligram and felodipine 5 milligram. No matter what you're taking, it should not exceed 40 milligram enalapril. It should not exceed 40 milligram enalapril. Okay, this one is ramipril and hydrochlorothiazide. Okay, this one is that one is common. Yes. Okay, in other version MDEX, it was boldly written here. Okay, let's continue so we don't waste time. Let's look for MDEX. The book, the reference book is loaded. I don't joke with it. It's loaded. Okay, now let's continue. So I said that we have enalapril plus hydrochlorothiazide. Okay, so we can have enalapril 10 milligram, and be sure we have not been disconnected. Okay, you're welcome. You're welcome. Sorry I keep checking because of what network is doing here. If anyone will know, you'll be cut off. You won't even know. You'll be here talking without knowing that you are talking to yourself. I like checking. All right, so let's continue. So in that case, now we have enalapril 10 milligram, hydrochlorothiazide 25 milligram. You can also have enalapril 5 milligram and hydrochlorothiazide 12.5 milligram. Then lisinopril, very, very common here. Lisinopril, very, very what? Common here. Lisinopril, we have lisinopril, we have to 2.5 milligram, we have 5 milligram, we have 10 milligram, we have 20 milligram, we have 30 milligram, we also have 40 milligram tablets. 20 to 40 milligram daily. We can also have lisinopril in combination with hydrochlorothiazide. There we have lisinopril 20 milligram, hydrochlorothiazide 25 milligram. We can also have lisinopril 20 milligram, hydrochlorothiazide 12.5 milligram. You can also have lisinopril 10 milligram and hydrochlorothiazide 12.5 milligram. In that case, no matter what you take, the maximum dose is 80 milligram lisinopril and 50 milligram hydrochlorothiazide. So we have moxepril, we have it at 7.5 milligram, 15 milligram tablets. And it can be taken 3.75 milligram to 30 milligram per day in 1 or 2 divided doses. The moxepril can also be combined with hydrochlorothiazide. In such case, we have moxepril 15 milligram in a tablet fixed dose combination. Hydrochlorothiazide 25 milligram. You can have moxepril 15 milligram, hydrochlorothiazide 12.5 milligram. You can also have moxepril 7.5 milligram, hydrochlorothiazide 12.5 milligram. We also have perindopril. Perindopril is also another example of ACI. We have it at 2 milligram, 4 milligram, 6 milligram. Can be taken 4 milligram daily. Maximum dose can titrate it to maximum dose of 16 milligram per day. Maximum dose, 16 milligram per day. We have quinapril. Quinapril, we have it as 5 milligram tablet, 10 milligram tablet, 20 milligram tablet, 40 milligram tablet. So, there's 10 to 60 milligram per day. So, 10 to 80 milligram per day in 1 to 2 divided doses. Then I think I've showed us a spray here. Ramipril, but this is combined with hydrochlorothiazide. As 1.2 gram capsule, 12.5, 2.5, 5 milligram, and 10 milligram capsule. So daily dose is 2.5 to 10 milligram daily. We also have trandopril. Trandopril, we have it as 1 milligram, 2 milligram, 4 milligram strength. And the dose is 1 to 4 milligram per day. We can also use Trandolapril. Did I say trandopril? It's Trandolapril. I call it Trandolapril. Sorry, trandopril. Trandolapril. Trandolapril. Because we also have it combined with hydrochlorothiazide. In that case, we have trandopril, 1 milligram, hydrochlorothiazide. What am I saying? Did I say hydrochlorothiazide? Sorry. Setting this out. We have trandopril, not hydrochlorothiazide. What I meant to say is verapamil. Verapamil, please, not hydrochlorothiazide. So we have trandopril, 1 milligram verapamil, 240 milligram. We can also have trandopril, 2 milligram verapamil, 80 milligram. We have trandopril, 2 milligram verapamil, 240 milligram trandopril, 4 milligram, and verapamil 240 milligram. And the maximum daily dose for verapamil, no matter what you are taking, for trandopril is 8 milligram, and that for verapamil is 480 milligram maximum daily dose. We also have lisinopril. This one is 10 milligram, 20 milligram, 40 milligram tablet, and we have 20 to 40 milligram per day. So these are examples. I've just run down these. These are examples of the angiotensin converting enzyme inhibitors. Murphy, you're welcome. Is it the Murphy I know? Murphy I know, say hi. You're welcome. If it's the Murphy I know, say hi. Okay, so this is we can already take for today on actions and uses of what medicines. In our next class, by God's grace, tomorrow we go over to the next group of drugs for what? Cardiovascular system. Cardiovascular system drugs. If you have any question, please feel free to ask. Drop questions on the comment section or drop your question. If you check the lectures in the TikTok is preview the main lecture. WhatsApp lines there. Your question on those WhatsApp lines, and by God's grace, you'll be able to. And please try as much as possible to go to our YouTube channel, subscribe from a TV school. And God's will, by tomorrow or this lecture will be uploaded there. What we do on TikTok is purely online, is purely live streaming. So after, TikTok cannot take more than 10 minutes. So we just put preview, but the whole lecture is uploaded in what? YouTube. So go to YouTube and watch the full lectures. As I said before, now just go to the playlist after subscribing and clicking on the button that looks like that. Go to the playlist. There's categories of courses there. Click any of the courses you are interested. If you want to watch anything on this, our academic battle. Wednesday we have our from entirely the school. We have physics academic battle, physics battle 3.0. Go through my TikTok. You see the flyer. So if you are interested, the registration is free of charge. If you are interested, copy a link there. There's a link there, registration link. Copy it out and they use it. Visit the site and register. It's free of charge. But there are prizes to be won. The competition holds every Wednesday and every Saturday here on TikTok live. The question is put here live. You answer it in the WhatsApp group. That's why it's important to register, so that you will be added to the WhatsApp group where you can drop your answers. As we solve the question, we answer the question. Once your time elapses, we answer it here. Everybody will see it. Those that emerge that send their answers within the stipulated time and get up to 50%, we have prizes for them. The prizes are there on the flyer. Please follow up on this. Follow this TikTok handle so that you'll be able to follow all the lectures and the academic competition. So this Wednesday is Physics Battle 3.0. And God bless you as you support us, as you give us your attention, as you give us time to listen to what we have to offer. And God will bless you more as you do so. Please tell others what is going on, so that others will learn from what is going on too. See you next time. Okay, at exactly the time, exactly 11 p.m. we are coming up again live for the last lecture of the day. So 11 p.m. come back here again for the last lecture of the day. See you then. God bless you.